Hello, I'm Wendy Cann. I'm Director of Post-Acute Services at KSB Hospital. June is Alzheimer's and Brain Awareness Month. Today we'll talk about Alzheimer's and dementia and how it affects brain health. Aging versus dementia, diagnosis and symptoms, prevalence, treatment, modifying risk, and support and advocacy. Dementia is a broad term that encompasses many neurodegenerative diseases. Alzheimer's is by far the most prevalent of these. When is forgetfulness normal and age-related, and when is it a symptom? Normal age-related forgetfulness can be occasionally forgetting to pay a bill or an occasional trouble with word finding or replacing or misplacing an item, but being able to go back and find it. Or it can be being unsure of the day of the week, but correcting oneself later. When is it not normal and should be considered a symptom? When forgetting disrupts daily life, forgetting recent events, perhaps somebody that called you earlier in the day or a visit that you recently had. It could be the inability to follow a familiar recipe or create a grocery list. It could be the inability to find an object that was misplaced by retracing steps. In 2023, 6.7 million Americans 65 and over were diagnosed with dementia. By 2050, that number is expected to nearly double to 12.7 million. In 2019, Alzheimer's and dementia became the sixth leading cause of death in the United States. How's dementia diagnosed? Home screening tests can be found, but evidence does not show that these produce valid results. One of the first steps in diagnosing dementia is to rule out other causes that could be making those symptoms appear. This could be ruling out effects from other medications, from depression, diet deficiency, or neurological diseases. Testing for these can include CT and MRI. These types of imaging would show defects in the brain, such as brain tumors or strokes. Next would be cognitive, behavioral, and functional tests. These would test memory and processing. By testing memory and the ability to plan and execute tests, these results can either indicate or turn towards or away from a diagnosis of dementia. Cerebrospinal fluid bathes and circulates around the brain and spinal cord. By sampling this through a lumbar puncture or spinal tap, this sample can be sent to the lab for study, and it's examined for biomarkers or substances that are present in the brain related to neurodegenerative diseases such as Alzheimer's. There are also blood tests available, but none of these are approved for use yet by the FDA. A normal brain weighs about 3 pounds, and it fills the bony box that is the skull. As dementia progresses, the brain shrinks as the brain cells die. Because of this progression, the areas controlled by these dying cells are affected, and this is what causes the symptoms that we see. This progresses from mild symptoms of memory loss to ultimately the inability to speak and swallow, and the person becomes bedfast. Ultimately, this person is susceptible to complications such as pneumonia, infection, blood clots, and failure of the organs. Early evaluation and treatment is important. While there are no current medications that will cure Alzheimer's and dementia, access to medications will help with symptoms and therefore improve quality of life. It also allows for an opportunity to participate in clinical trials to develop new and effective treatments. It also allows the person to change priorities regarding their health and to prioritize life choices. It affords them the ability to express their desires regarding financial, legal, and end-of-life choices. It's also a very important opportunity to discuss with family members and caregivers potential safety risks that may evolve. It's so much more beneficial to have these discussions before it's a crisis related to wandering or driving. I can't stress enough how important this is, because it truly is a gift that we can give to caregivers to have these discussions ahead of time. There are risk factors associated with dementia and Alzheimer's. Some of those we can't change, such as our age, genetics, and family history. However, some are modifiable. If we consider that 20% of our body's energy and oxygen supply is used by the brain, it makes sense that maintaining a healthy cardiovascular system aids in supporting brain health. The heart pumps the blood, which carries the oxygen and food to the brain through blood vessels. Therefore, managing weight, high blood pressure, cholesterol, and diabetes becomes very important in supporting brain health. The need to maintain emotional and social connections is also important. Sleep is also very important in maintaining brain health. While we're asleep, our brains are cleaned of the toxins that build up during the day. I think about this as a busy store or a busy restaurant that closes at night and allows the night janitor to come in and sweep away the debris. Therefore, practicing good sleep hygiene is important for getting good, healthy, restful sleep. It's very important for brain health. The Alzheimer's Association distills this to 10 healthy habits. Challenge your mind, keep learning, exercise, protect your head, and this includes wearing headgear and seatbelts. Don't smoke, manage diabetes, manage high blood pressure, eat right, and maintain a healthy weight. Again, practice good sleep hygiene and allow the night janitors to do their work. Support and advocacy is extremely important for both persons with dementia and for their caregivers. The Alzheimer's Association has a 24/7 helpline at 800-272-3900, or you can go to alz.org. We do have a local support group that meets in Dixon on the first and third Thursdays of the month at 4:30 p.m. at the First Presbyterian Church in Dixon, which is behind the Old Lee County Courthouse. This is drop-in for caregivers of persons in all stages of Alzheimer's and dementia. If you have questions on this presentation, you can call me at the hospital at KSB and ask for Wendy Cann. Thank you. Bye-bye.